Good morning and welcome to Today in Putnam County, hosted by Putnam County Mayor Randy Porter, the show that takes a look at the events and what's happening all around Putnam County, as well as interviews with local, community, and business leaders. And now, sharing his insights and experience, here's Today in Putnam County with County Mayor Randy Porter.
Thanks, Philip Gibbons. Thank you for joining us today. Hope you're having a great weekend. Hey, this week's show, it's about women's health. And my guest is one of our longtime physicians here in Cookeville, Dr. Paige Gernt. And she is one of our OBGYN physicians here, been here several years. And we're going to talk about women's health. We're going to talk about a new merger with OBGYN here in Cookeville and a whole bunch of stuff when it comes to women's health. So good morning, Paige.
Good morning. Glad to be here.
Glad to have you on the show. And full disclosure, so she's one of my favorites. She delivered my granddaughter about 7.5 years ago, and we're so thankful for you and glad you're in Cookeville. And I just got to know, first question I got to know is, do you keep a count of how many babies you delivered?
You know, I don't have an exact count, I don't, but I do know how many we deliver each year. So, over this many years, it's been a lot.
It's been a lot. I just wondered if the OBGYNs kept up with how many babies they delivered. On an average year, babies in Cookeville, what do we get?
Yeah, you know, the hospital at Cookeville, as we all know, is very busy, and we seem to deliver around 1,500 to 1,600 babies a year.
Wow, that's a lot.
Now, of course, that's not just myself. It's a lot of other people, my partners, the midwives, other practices. Yes.
Wow. And we're going to talk more about the midwives and the practice and stuff as we get on down in the show. But let's talk about you first. Give us some history of kind of where you started, where you went to school, and what brought you back here to Cookeville and practicing here for all these years.
Absolutely. I think a lot of people know that I love this Upper Cumberland region, and I grew up in Fentress County, and I grew up in the little town of Allard.
Oh,
just
wow.
a little four-way stop there.
What is it, the Pumpkin Festival?
The Pumpkin Festival.
Yeah.
Everyone knows about the Pumpkin Festival. And I attended York Institute, and then I went to a small college in Kentucky, Transylvania University.
Oh, wow.
And then from there, a lot of people think I went to med school from there, but I did some more cancer research, bench research at NIH, National Institutes of Health.
Yeah.
Great experience for me. And sometimes I think we all know that the good Lord just puts the right people in front of you.
Yeah.
And I had a very good mentor advisor that encouraged me to go back to med school. And I did. I applied to University of Tennessee, and I was glad to be accepted and kind of make my way back home from Maryland, of course. I always wanted to be back in Tennessee, and did my 4 years of medical school there. Then I attended the Medical University of South Carolina in Charleston for my residency. Had a wonderful time there. Beautiful town to live in. I think we all know that. And I was a teacher, the attending physician for a while at the Medical University. And then I actually even joined a practice with some of the women that I went to residency with. So really fun and really rewarding. But there was just always this little nagging or tugging that I needed to get back home. Need to get back home. And the way it all happened is, and I don't know if everybody knows this, that I'm really good friends with Dr. Bert Gear.
Yes.
He's the urogyn or pelvic floor specialist in town. And he was a resident when I was a med student.
Oh, wow.
Yes. And so goes way back there. And when I wanted to head back this way, I called him and he said, you know, Paige, I think now might be the perfect time to come back. And I joined what was OBGYN Associates in 2005. I can't believe it's been that long ago.
This 19 years.
19 years. And that was Bert and Dr. Mike Pippin and Dr. Jeff Gleason. And we just had a wonderful time together. I'm still good friends with all of them. Absolutely.
Yeah, Bert's a great guy, and the others are too. I remember years ago when I was paramedic school, and the big thing that, I don't know why we were always scared of it, but delivering babies, that was the big thing because you didn't do it very often in an ambulance, but did a rotation with them and got to go in on some deliveries and made a huge difference in my confidence as a paramedic. And I'll never forget, I hadn't done that residency very long after that, and our radio listeners may not understand this, but had a prolapse cord up in Monterey. We were 30 minutes out and had to take every time we'd let up on the cord while the baby, the heartbeat was stopping. I'll never forget that, because I always thought that all the knowledge I got from those OB guys and gals made the difference in that baby surviving, and it was a great thing. So 19 years. And then here recently, y'all made a change. And I don't know if you call it a merger or what you call it, but Diana Health came into the picture. Right. So how's that work?
Yeah, and we're really excited about this merger. And a lot of people ask me kind of how that did come about. And I think the first thing is really that this place is exploding. We all know that. This Upper Cumberland region is just growing by leaps and bounds.
Oh, unbelievable.
And we started seeing that we just had to keep up with that pace, and we needed to make sure we had everything we needed to offer all these women in this area. And I think a lot of us think of our OBGYN experience as delivering a baby or having a yearly pap smear, but that's not it at all, really, when we think about it.
It's a much bigger picture,
right,
isn't it?
We need to take care of the entire woman, or the whole woman, as we say. And this has given us just a chance to have more providers, more midwives, but so many different options, such as mental health, dietitian, telehealth, just sort of going to that next level to have more of a comprehensive approach for women's health care. And it just doesn't translate just to my office, where my partners and I are, but it's even part of the hospital. We've really got new services. We've begun new services over there as well.
Yeah. And so our guest today is Dr. Paige Gernt. We're talking about women's health and a new merger with Diana Health and the OB/GYN Associates. And so we're seeing a shortage of healthcare practitioners, not enough paramedics, not enough nurses. Are you seeing that same thing in your OB/GYN field?
We sure are. We realize that not many people in the medical school classes are going into obstetrics and gynecology, so much fewer people going into those residencies, graduating, and wanting to provide the full scope of practice.
I don't know how we fix that. I know that we used to have people lined up wanting to become a paramedic and nurses and those kind of things, and I don't know if COVID had a lot to do with that. I think it did in some way. It did with us, trying to have the paramedics and people going to school, but kind of messed things up, didn't it, for a while? I mean, I know it had to be a major undertaking. It was for us to deal with that, with trying to deliver babies and parents and all that stuff during COVID. I'm glad it's over, aren't you?
Oh, I'm very glad it's over. Having a baby or gynecology surgery, it's such a personal. Yeah. And you need your family support often. And when we couldn't have the siblings, the aunts, the uncles, the sisters, the mom and dads up on labor and delivery, it was just, I can't even explain how odd that was to me. I know it was odd to the patients, but it was odd to us. It was just not as a happy place. Yeah. It just was not as fulfilling. You just could tell people, nurses, secretaries, everybody noticed the difference.
It changed her. It was different, our attitudes. Merger with Diana Health, which is, it's giving you the availability of a lot of new stuff and new things to be able to help the women here in Upper Cumberland. Can you talk about a few of those?
Yes, I think you're right. It gave us a lot more resources, a lot more tools. I'll first start with how we partner a little bit with the hospital. Yeah. And I think that's one of the biggest differences that our patients are telling us that they really like.
And you're not owned by the hospital, right?
We are not, but we work with our hospital every day.
Great relationship.
We have a wonderful relationship with them. And now we have someone, a provider on labor and delivery 24 hours a day, 7 days a week. Wow. Patients are loving that because they're not having to wait for someone to come see them. They feel like they're having more attention to them earlier on. We hope then their needs are met and that their hospital stays on as long.
Oh, yeah. We were talking earlier Used to be, I guess, most women, if they were pregnant or having the baby, was part of OBGYN and then their annual pap smear. But it's a lot more now, isn't it? We're trying to make sure you're dealing with all the aspects of the female health, right?
That is correct. I think that was our goal, that the word that's used a lot, and I like the word, is a comprehensive approach to women's health care. Yeah. And, of course, we all love the obstetrics. I think all of us love delivering a baby, all the providers. We enjoy our gynecology surgery. We see patients in the office. But I think we realized there was so much more we needed. We now are so excited. We have a dietitian in our office. Her name is Katie Malone. And, gosh, I think we all know we keep her very busy.
Oh, yeah.
One of the big things that I guess I first think of is gestational diabetes, because this may be a young woman that's never in a million years thought she would have diabetes, and it shows up during her pregnancy. She's never had to talk about dietary changes. She's never had to stick her finger for a glucose. And so Katie has been just a treasure because she will go in and spend time with those patients. Yeah. But it's just not the pregnant patients. I think we all know there is something like polycystic ovary syndrome that has insulin resistance. We have menopausal women that want to change their diet. So, like I said, I think she's got a lot on her plate now.
She does.
Yeah. We do also have her do some telehealth visits, so I don't want people to think, oh, I've got to make an appointment in the office. That's one of the other benefits, that she can call or Zoom, as we say, or perform a telehealth visit.
Isn't that neat? I did one that I had to do to get a prescription refilled the other day, and I just thought, how neat this is that I don't have to go sit in a doctor's office somewhere and wait. And I had my scheduled appointment. We connected at a certain time. You know, it probably lasted 4 or 5 minutes. And I just thought how neat that is, that we're using today's technology to be able to have that connection with your doctor's office, and not having to maybe wait a month or, I mean, I know there's a shortage of healthcare providers, not have to wait a long time to be seen.
I agree that I think telehealth's made a huge difference in that. And a lot of people say, well, you have to really see your patients in the office. And there are many, of course, I would need to see.
Depending on the situation.
But we use telehealth, I think, more than people would realize. We use a telehealth visit to discuss contraception. We use a telehealth visit for preconceptual counseling and maybe to discuss an upcoming surgery. So it's used more than people realize, I think. And that kind of segues into another new, I guess, facet that we have, is that we're trying this out now, some online scheduling, so the patient doesn't have to call in and speak with someone every time to make an appointment. That's a new thing we're trying right now. It seems to be working well. It's not for every appointment yet, but I can see that's going to be more in the future.
Go to your website. It's kind of like scheduling your car for an oil change anymore, too. I mean, you go online and do it, and you pick a time you want to do it, and then they follow up with text messages, and so it's coming into the healthcare field, isn't it, Paige? I want to talk about some of the new things, some of the new technology that's come into healthcare, especially in your end. And we're talking with Dr. Paige Gernt today, and their show's all about women's health. The Da Vinci robotic surgery, I know as we were talking during break, has really changed the way surgeries are performed anymore. Has that made a big difference in your field also?
It sure has. I told someone just the other day when they were asking me, I believe it's one of the most exciting things I've seen in my career. And it has changed so much. It's so precise. The visualization is amazing. The instruments that have been designed, it's just mind-boggling sometimes where we started and now where we are. And I think what I see is that just through little incisions, trocar incisions as we call them, we can really perform much more extensive surgeries where maybe in the past we would have had to make a big incision, and people are going home the same day. I mean, they're not staying even overnight. They definitely aren't staying 2 or 3 days like they used to. I really think the quality of that post-operative care, they are just getting back on their feet sooner. And that's a great thing. I got to ask, was it hard to learn? I mean, to be able to work on somebody with pushing buttons and pulling triggers? You know, the Da Vinci company has a very good training program, and you do go to other labs and then you train with other doctors. And Some of the residents, of course, now coming out of residency are learning
already
it.
Trained, yeah.
But my age, or we had to go and then learn it after the fact. And then I always have said that kids that are probably about 15, 16 that play with all these, computers and computer games, they probably would be excellent at it.
Yeah, that's amazing that watching someone do the surgery with that's made a huge difference. Some of the other things that's new, and one of them amazed me, we had a ribbon cutting last year at a place where they were doing the new 3D imaging, and they showed us images, and I've seen some friends of ours that were pregnant, and I mean, you can see the baby's face. That's just amazing. That's got to have improved the health care of the mom and everything to be able to see that detailed of an image with those babies.
I do agree wholeheartedly. I said I'm dating myself a little bit, but I think when we were my age, we were in residency, I feel like everything was, the word I would use is grainy, on the actual monitor. I cannot believe the clarity and what you can visualize now on a fetus. And again, absolutely helping the health care of the fetus and the mom, because we pick up small nuances, and then we may say, is that quite right? Then we can repeat the ultrasound. If we still are concerned, then we usually refer to a maternal fetal medicine. And that is, of course, what we would consider a high-risk obstetrician. All they see would be high-risk problems. And we're fortunate for that. We now have those in Cookeville. So it's really, I've seen so much change in that clarity, and now we even have 3 ultrasound machines in our office.
In your office.
So people don't have to travel. And we do all of the serious ultrasounds, but we also offer the fun ones too. We do the fun ones too, and everybody seems to like that, because with the 3D, as you just said, you can often see so much detail that you'll be like, wow, that baby's going to look just like the dad.
Yeah.
And it's fun.
It
Very
is.
fun.
It's amazing that technology. I'm glad to see that in the medical field, I mean, with all the gaming technology and stuff they've had for years, that's moving into the medical field with all these new procedures. And that kind of falls along with, I was reading about the minimalist revolution, where they were talking about minimally invasive surgery and procedures. And that's kind of follows up with that Da Vinci and trying to do smaller incisions or simpler surgery instead of for a lady to have had a hysterectomy 20 years ago was a big deal with large incision and stuff, and today it's a lot more minimal, isn't it?
Yes, it is. I think all of us are trying to perform those surgeries. We discussed the Da Vinci, the robot, as we say. And, of course, we're talking about gynecology surgery, but it's really used in a lot of different fields. We see it used in pulmonary, in urology, the pelvic floor, as we said. I'm trying to think, ear, nose, throat. I mean, you can just keep going and going with the new techniques. General surgery uses it also. I think things people may not know that we've been doing also, gynecologists, anything that has a scope on it, laparoscope looks in the abdomen, a hysteroscope would look into the uterus. Just so many things we can do with these small instruments that don't cause the patient a lot of pain, and we get our answers and our diagnoses without so much trauma.
Right. We're talking earlier during the break about this merger with DynaHealth, which is kind of a regional deal that you brought into, and you think by merging with it, it's been giving you the ability to offer a lot more services than what you could as the small office you were before. Is that hitting it about right?
That is true. I think we touched on a few earlier, like dietitian, but one that really is needed in this area is our mental health services.
Absolutely.
And we do have great counselors and psychologists in the area, but I think everybody knows we really don't have enough of those providers. And I do feel the relationship between a patient and their OBGYN provider is also very special. It's very intimate. And I think we have our patients really reach out to us about things that are going on with them. I think, the one for me that would be the biggest would be postpartum blues or postpartum depression. And we now have special counselors, nurse practitioners, mental health counselors that will come and talk with those folks. Also, telehealth visits are available. And again, I think that's really important. Those patients can be at their home by themselves talking to someone just one-on-one. But again, we see patients from probably about age 12 to 90.
Yeah.
And so we deal with a lot of depression, a lot of grief when someone's lost a loved one.
Yeah.
And they ask us for recommendations.
And that was something that's not been dealt with in the past the way it should have been, right? So I can remember my wife when she had Paige, my daughter Paige, and
that's right.
She had the postpartum depression after that, but it wasn't something that was really talked about that much. Of course, that's been 32 years ago, but today that's a very real thing that needs to be dealt with. So now it is, right?
Yes, it is. We talk about it very openly. I don't think there's any provider that's shy about bringing it up anymore because we realize how serious this can be. We also call patients with a postpartum follow-up now. We have them fill out a depression score, and we really try to be aggressive with this if we see this occurring.
That's great. Mental health is just as important as your physical health.
That's exactly right.
I'm glad we finally woke up to that,
yes.
On a country. You've got, with Diana Health, with the merger, you've got a new app that folks can put on their phone. Tell us about that.
That's exciting when I see all of this new technology, and it is Diana Health app, and you download it on your phone, and we have patients love this, and they can see their lab results, their pap smear results, their mammogram results. They can also message us, message my nurse, message me, and that way they're not always waiting for a phone call back. We can hopefully answer that even in a quicker fashion.
Right. Just in your opinion, you've been in this almost 20 years here in practice. Are women taking better care of themselves, you think, now than 20 years ago or 30 years ago with all the new availability of everything?
I do feel most women are. I think you and I have talked about it before that some women don't put their health first, but most women now are not scared to ask for things. I think they feel comfortable. I think hopefully we make them feel empowered to ask questions, not be shy about bringing up a problem. I always say the one that we always use as an example is something like urinary incontinence. Yeah. Women just would not bring it up.
They won't talk about it, right?
Now people are active. They're out doing things with their grandkids. They're jumping on a trampoline. We want people to stay active. We want them to have their normal lifestyle.
That's great, and I'm glad we're seeing that it's changing. We were talking about babies being born, and of course you deliver a lot of babies, but back in 2007, from the stats I pulled, it looked like we kind of peaked on the number of babies that was being delivered in the country. But COVID come along, and I think we all thought that we'd see a baby boom from that because of everybody being confined and we weren't going anywhere and we weren't working. That didn't happen, though, did it?
It didn't happen at all. I think everyone thought that we would see a baby boom. Actually, the birth rate nationally went down. And the thought was that women were scared to get pregnant and have a baby maybe when they had COVID or could get COVID. But then what if they delivered a baby and the baby had COVID?
Yeah.
So we saw a big decrease in the birth rate. But I feel like now we're starting to
moving
see it
back up
starting
the
to
other
move
direction.
back up. Yes.
Probably won't get back to the having 9 or 10 kids like my great grandparents did or some of those.
No, I don't. I have a few families, but I don't see that very often.
Yeah. So I'm going to ask you, if you could change one thing about the attitude of women's health with women, is there one thing that sticks out at you that you said, if I had a magic wand and I could change your attitude about this, what would it be?
A few things come to mind pretty quickly. One is preventive medicine. You don't want to wait always until something's wrong with you
reactive,
and then fix it.
Yeah.
So I would probably say preventive medicine. Please come get your pap smear. Please get your mammogram. Nobody wants to get a colonoscopy, but please get that colonoscopy. These are things important. I talk about. Another perfect example of another screening test would be the DEXA, the bone density test for osteoporosis. We just want to be, as we said, on that proactive side, not reactive side.
reactive.
Another thing, again, just when I say taking care of yourself, I still think we have an incredibly large number of smokers in this area, and we do see that it really takes a toll on the body. And I guess I'm thinking from a pregnancy that the babies just don't grow well, the placenta's affected, and I always say the placenta's the lifeline to the baby. Right. So if it's not functioning correctly, then we may have problems.
Wave that magic wand. Don't smoke and that preventive maintenance. It's kind of like your vehicle. I mean,
that's right.
You don't change the oil, you don't rotate the tires, you don't do anything. Some point you're going to break down, and that reactive thing is not good. Can you imagine, we only got a minute or so left, but with everything that you have saw just in your career, the changes, I mean, can you imagine what the next 10 or 15 or 20 years is going to be in healthcare?
I really can. I think we used that little phrase the other day when we were all talking about it, that we've just touched or skimmed the tip of the iceberg, or the surface. I think we just won't believe what's coming next.
It's amazing, and I know it's exciting in your job to be a part of that. And I know it was exciting when we had the ribbon cutting for Diana Health, and I was amazed. I mean, OBGYN been here for a lot of years,
almost 50.
Yeah, and so I mean, it's still the same practice. You just did a merger, but the remodeling of the building that you did, I was amazed at how well that looks, and I guess how peaceful and welcoming it is on the inside, and your staff is so good.
I'm so glad that I knew you had seen it, and I'm glad that you liked it so much. We do feel like it was a labor of love. Anytime you're trying to work somewhere while you're remodeling, is something. Yeah. But we are very pleased with the final result. Also, I do think it has a little bit more of a calming or comfy, inviting environment. So we're real pleased with it. And, I think, Randy, you and I said, why do we want to keep doing this? But, I want this place to be the best.
Absolutely.
I want us to have the best women's health care. And I don't want people to feel like they need to drive to Chattanooga or Nashville or Knoxville. They need to stay right here at home with us.
Absolutely. I feel the same way. Thank you for being on the show. I appreciate you.
Thank you for having me.
And thanks for what you do for women's health and all the babies. And I just, you've got a following out there that if you mention your name, there's always a story about what she delivered my
thank you.
daughter or grandbaby or whatever. And we appreciate you. We appreciate what Diana Health and all y'all are doing to try to make it better and make it good here.
I think everybody knows I love it, and I love going to work every day.
Absolutely, and that's 90% of it, isn't it?
That's right.
Hey, that's all of our show for this week. Hope you join us every weekend for Today in Putnam County, right here on all the Zimmer family of radio stations. I'm County Mayor Randy Porter. Hoping you have a great rest of your weekend. God continue to bless our great county.
You've been listening to Today in Putnam County, hosted by Putnam County Mayor Randy Porter.